difference will the changes to hospitals make to the ambulance service?
So I'll answer that in two ways. In my long-term wake-up that I screening vision that I talked about earlier, I think the provision of access to data about known vulnerable patients and known treatment preferences will revolutionise the way in which the ambulance services convey patients. And it's not that far away. Far from what I talked about earlier is on the Isle of Wight. They have a system in play where the ambulance services access hospital and the GP systems. It's not completely universal, it's not working through it, but it's in place. And I think that'll be very significant in terms of freeing up resource and the type of service that the ambulance crews provide. More specifically, RED really relevant provides more space for ambulance services to sort of send through. We're expecting our ambulance crews to come through. We would expect to reduce the turnaround time of those and to have the number of monitored beds and bays for complex patients in the right place. It was designed 20 years ago, as I said, at any department, so we should make that a much slicker, safer process for ambulances. Not too slick, because we would have managed them to turn up. The turn up last week was very significant. Until stop Tesco's doing their special offers on lunch.
I'd just add a couple of comments to that. I think we've seen some really significant changes from changes in our model of care that have led to changes for the ambulance service. A really good example is the designation of some emergency departments as major trauma centres. So what that means is that ambulances know where the facilities are for a major trauma centre, and so when someone has had a significant or serious accident, they don't just take them to any A&E department, they take them to one that has the specialist services that can be wrapped around that patient when they arrive to get the best clinical outcomes for those sorts of patients. Other examples of that are our hyperacute stroke service and our heart attack centre. Again, when you have a heart attack these days, the ambulance won't just take you to any A&E department. They will look at your ECG, your graph of their heart, and see that there are issues in terms of your heart, and they'll take you to a designated heart attack centre, again, where you get the best outcomes. Hyperacute stroke service is another example where those stroke services have been centralised around London. So if you've had a stroke, you get taken straight to a hyperacute stroke service, and you know your clinical outcomes will be much better, your outcomes will be much better, and we have saved a significant number of lives from really streamlining those sorts of services. So they're just some examples of changes in model of care leading to quite a change for the ambulance service.